Okay, so we're going to run through a kinesiology taping technique for the sacro-iliac joints. So you can tape one side at a time. I'm going to run through two because I like to do it bilateral so that there's symmetry there. So you're going to find the lumpy spot on the back of the pelvis here. So you can run your hands down over the crest there and then run down. So you've got the soft tissue up here, and then you've got the bony pelvis that runs down through here. And you get to the end of that where there's a little lump. So often there's a dimple there that can help you make sure you're in the right spot. So we're going to use the first few centimeters of tape as an anchor, and that's going to go just underneath that lumpy spot, which represents the sacro-iliac joint. So we're going to run the tape almost directly vertical up the spine. It's going to go a little bit from inside to outside as we go up. So we're going to pop the tape, the anchor down as low as we can so that we've got some stretch over the sacro-iliac area. We're going to do that first of all on both sides so that we've got those anchors set up. Okay, and so from there, Mary, if you can bend forward, we're going to get some good flexion in through the back. So that's a forward bend through the back. And then we're going to take the tape off so that again there's an anchor of a few centimeters, and then support the tape that you've just put the anchor down on. We're going to make sure we go across this lumpy spot here, add some stretch to the tape, and then lay it down onto the back. The upper portion of the tape will be slightly outside of where it is on the lower portion, so it's going to form a V as you come up. So same on the other side. We're going to put about 30% stretch into the tape, and it's going to run again to the outside slightly, forming that V. You can stand up there now, Mary. So if someone's in a lot of pain and they can't support themselves leaning forward, you can get them to lean on a surface like a bench to support the back there. So we're going to take again that anchor point, take that off. You're going to come around, find that sacro-iliac joint again, that lumpy spot. You're going to come around to the side, just back from the midline. You're going to go a little bit lower than the lumpy spot, the sacro-iliac joint, and lay that anchor down there. And then we're going to take the backing off, again exposing a few centimeters anchor. I like to recheck just to recalibrate where those points are that I'm going through. And then we're going to again put some pressure through, or put some stretch through the tape. You're covering over those sacro-iliac joints, and then we're just edging down as we go through, curving down, and then anchoring around the side of the body. So the idea with this piece, can you just turn to the side a bit, Mary? That's it. The idea of this piece is that there's a slight curve on it downwards, and then these guys come up in a V. So make sure you rub over that tape, because heat activates the adhesive, to get that sticking really, really solid. And then we're going to monitor that 5 to 7 days. That tape will stay on. If there's any itchiness or irritation, just take the tape straight off.